I'm Dr. James Lozada in Boston at the SOAP 2016 annual meeting. Let's take a look at a few of the ways obstetric anesthesiologists are working to improve healthcare.
It's a city with an illustrious medical history. Boston offers the perfect backdrop for the annual meeting of the Society for Obstetric Anesthesia and Perinatology.
I think there's real value and insight that we provide each other, and there's no doubt that we need to work collaboratively.
Anesthesiologists, obstetricians, and pediatricians gather here, jointly focusing efforts to make pregnancy and childbirth safer for mothers and babies.
It was not really until the late 70s that it was very clearly pointed out that pregnant women might be more difficult to intubate than non-pregnant.
It's a discussion that knows no borders. Doctors from around the world come to SOAP, many attending this Spanish symposium with translators on hand
that lead to a near death
for key lectures.
The fetus does not get...
In one of the most informative
the anesthetic.
And she specifically desired one technique over the other one.
And lively sessions.
You always need a plan B, and particularly in this case.
This panel engaged in a spirited debate about approaches to clinical conundrums.
80,000 yesterday and 40,000 now. This patient requires a spinal anesthetic. We're going to start with Robert.
I would not perform a spinal anesthetic if it's truly severe preeclamptic, who's unstable. It depends on the fetal status as well. I would have no problems giving a regional anesthetic.
The exchange of ideas adds to rich learning opportunities, like at the much-anticipated Gerard Ostheimer lecture, What's New in OB Anesthesia, where Dr. Philip Hess urged action to address the rising U.S. maternal mortality rate, especially high amongst African-American women.
If we don't get this right, then nothing else really matters, does it?
Practice improvements have decreased rates of maternal hemorrhage, preeclampsia, and blood clots. But new killers have emerged.
Unfortunately, because of our changing demographics, the relative contribution of maternal comorbidities, cardiomyopathy, and cardiovascular disease have increased, so they are now the major killers of pregnant women.
These conditions and complications were the focus of active poster sessions, highlighting important case presentations and new research, much of it from fellows and residents, future leaders in the field.
I think this is the place to come to. This will help you build ideas. You see what other people are doing and what you can add to it or what you can deduce from what they have done to help you, make up your own scientific questions.
It's a good thing. It's a good thing I did a C-section.
Obstetrician Neil Shaw focused his forward-thinking talk on how hospital systems and OB floor designs impact cesarean delivery rates. He says improvement begins with greater investment and passion.
We spent 80% of federal dollars in the last 9 months, and a very, very small fraction of that on the first 9 months when it's such a higher leverage moment. For government to invest, you need collective action. There's no urgency right now.
SOAP 2016 was marked by a social media push to foster connections.
If I can learn how to do Twitter, you can learn how to do it. I've actually had a lot of fun learning in the last 2 weeks.
Analytics show impressive engagement and wide-scale participation. Dr. Ron George fired off an amazing 200 tweets during the conference. He says the SOAP community helps him deliver the best possible care to women.
I leave here with a notepad filled with research ideas, quality improvement ideas, emails, contacts, Twitter notifications.
These little tiny babies will grow up.
This year's neonatology update focused on supporting and nurturing babies during critical moments.
I feel very strongly it's very important. These babies' brains are undergoing a critical period of development from 35 to 40 weeks. The closer we can get them to 40 weeks is going to protect this critical spur.
Between lectures, many attended sessions like this, aimed at learning new ultrasound techniques and improving skills.
And that award goes to Dr. Katie Arndt from Mayo Clinic.
Yearly teaching honors and research awards went to particularly deserving candidates.
Has anybody ever re-intubated an obstetric patient in the obstetric vacuum?
And Dr. Jill Meyer challenged anesthesiologists to face the pain of medicine's evolution while assessing healthcare quality.
We have to have measures. So the question is, what should the measures be?
By success measures, the SOAP annual meeting hits the mark, fostering learning, improvement, engagement, and camaraderie.
Join us for the SOAP 2017 annual meeting in Seattle. You can also follow SOAP on Facebook and Twitter, as we continue work to improve pregnancy and healthcare outcomes for mothers and babies worldwide.